Okay, this is Shelley Hughes doing my cardiac, lungs, and perivascular assessments. Nathan Hughes has agreed to be my patient today. So I'm just going to do a quick scan of the room to make sure that there are no notes or anything cheat-wise. See everything. That's just my prop that I'm standing my computer up on with my book there. Okay. And then back to here. Okay. Make sure you can see right. Okay. So, all right. At this point, I would check the chart outside the room. And I would just make sure there was a doctor's order in for me to go in and do an assessment. And I would also see whether the patient required me to wear PPE, which this patient does not. Knock on the door. Go in. I would either close the door behind me or close the curtain for privacy. I would wash my hands and wear gloves if necessary. And then introduce myself. Hi, I'm Shelley. I'm going to be your student nurse today. How are you?
Doing good.
Good. Can I verify your name and date of birth, please?
Nathan Hughes, October 18, 1985.
Okay, that matches his wristband. What brings you in today?
Checkup.
Okay, do you have any questions or concerns for me right off the bat?
Nope.
Okay, are you in any pain today?
No.
Okay, so your doctor did put an order in for me to do a cardiac, lung, and perivascular assessment, so I'm going to be doing a combination of inspecting, palpating, percussing, and auscultating the sounds and rhythms of your heart and lungs today. Does that sound okay?
Yep.
Okay, let's get started. May I call you Nathan?
Yeah.
Okay, very good. So have you had any neck injuries?
No.
Ever had any surgeries?
No.
Are you having any pain or stiffness in your neck at the moment?
Nope.
Okay. Do you have any thyroid issues?
No.
Okay. Have you noticed any swelling or anything in masses popping up in your neck? Okay. So I would inspect, just visualize me. His head is normocephalic, appropriate to his body size. His skin color has nice pink undertones, appropriate to his ethnicity. I don't see any cyanosis or pallor. On his face and neck, I don't see any lesions or scars or ecchymosis or signs of erythema. The hair on his head is evenly distributed along with some of the facial hair on his face. I am going to just palpate the neck to feel for any swollen lymph nodes. Let me know if you feel any tenderness. Okay, I don't feel any swollen lymph nodes. I'm also going to feel for his pulse along the carotid artery one side at a time at the lower third portion of his neck. If you can just lift your neck just a little bit. Okay. All right, his pulses are equal bilaterally. I'm at a 2+. I'm now going to take the bell of my stethoscope and assess his carotid, go down the carotid artery on 3 sides, or 3 places on each side, underneath, sorry, that's the train, underneath the jaw, the mid area, and then near the base of the neck. So, and I'm going to assess for bruits. So Nate, when I get ready to put the bell against your neck to listen for bruits, can you just inhale for me and then exhale and kind of hold that exhale? This is so none of the tracheal sounds can sound like a bruit coming from the carotid arteries. Okay. Okay, turn my bell on. Okay, just lift your head, just lift up a little bit for me and then inhale. And exhale and hold down. Okay. I did not hear any breweries in his carotid arteries. And upon also inspecting Nate, I noticed that when he speaks and when he's breathing, his trachea is midline. It's not being pushed or pulled to one side. I do not visualize him using any of his accessory muscles to help him breathe, which indicates to me that he's not in any signs of respiratory distress. Okay, so I'm then going to go on to your upper extremities. And if I could just, you can put your arms out for me. Just feeling his arms. They are warm and dry to touch. I see that his skin color is evenly distributed pink undertones appropriate to ethnicity. His hair distribution is also evenly distributed and it matches the color of the hair on his head. I'm going to feel for any bony prominence, along the bony prominences, to feel for any signs of edema. And if he had edema, I would rate that. I do not see any signs of edema along his bony prominences. Okay, going down to his fingers, looking at his cap refill. His cap refill is brisk, less than 3-second refill time. I'm also going to feel for his radial pulses on each side. And they are equal bilaterally at a 2+. I'm now going to feel for his radial pulses. Still see, okay. They are equal bilaterally also at a 2+. Do you have any weakness or any stiffness in your arms?
No.
Okay, do you notice any atrophying?
No.
Okay, I don't see any signs of, again, lesions or masses. Can you grip my fingers? Okay, and now pull me. Push. Okay, let go. The strength in his arms and grip are equal bilaterally. And again, no signs of atrophying present. I'm now going to move on to the anterior and posterior chest part of the exam. Do you have any history of heart disease?
No.
Do you have any shortness of breath when you are doing regular activities?
No.
Do you have any pain in your chest or in the back of your chest when you breathe?
No.
Are you a smoker?
No.
Are you regularly exposed to pollution or harsh chemicals in the environment?
No.
Okay. So I'm going to start off by looking at the chest and noticing that his skin color is consistent and appropriate to his ethnicity. I'm just going to take a look and see that the hair distribution is equal. I don't see any signs of lesions, no ecchymosis or erythema present on his chest. I'm going to palpate and let me know if you have any tenderness, and this will also, I'm going to check for signs of crepitus. So just let me know if you have any tenderness. Okay, no tenderness, no crepitus noted. I did feel that his skin is warm and dry to touch. I am also going to assess his skin turgor, subclavicular area, and it is elastic. I'm going to verbalize how I would assess his jugular vein distension. I would actually have him lie flat and relax, and then I would then have him sit at a 45-degree angle. I don't have a chair that reclines that way, so I'm just verbalizing that I would assess whether there was still jugular vein distension when he was sitting at a 45-degree angle. Okay, I'm now going to go on to assessing for tactile fremitus. When I put my hands starting at the apices of your lungs and going down the chest to the fifth intercostal, or to the sixth rib, the fifth intercostal space, I need you to say 99 each time I touch, and that's just going to assess for resonance.
Okay.
So
99, 99, 99, 99, 99.
Okay. Resonance is good. I do notice the vibration diminishes as we go inferior from the neck, which is an unexpected finding. I'm next going to percuss the same areas that I just assessed for tactile firmness. And so I'm just going to percuss with my middle fingers. Okay. I did not note any dullness. Everything was kind of a clear, hollow sound. Had I noted any dullness, I probably would have done it again just to make sure I was not on a bone, because that'll give me an automatic dull sound. So without the presence of the dullness, I don't think there's any fluid or masses underneath his in his lung cavity there. I'm now going to listen to those same areas just for any adventitious sounds such as crackling, wheezes, or rhonchi. I'm going to do this with the diaphragm of my stethoscope, starting at the apices of the lungs and moving down to the 6th rib. I'm just going to go to this side. And when I touch you with my stethoscope, would you take a deep breath each time? I did not notice any adventitious sounds, no crackling, wheezes, or rhonchi noted. His breath sounds were rhythmic and they all sounded clear. I'm next going to move on to the posterior chest. I am going to assess his thoracic expansion. Could I have you turn around, please?
Yep.
That's the camera. Okay, so I'm going to assess the thoracic expansion, which is going to be at the T10 mark. And the way I find T10, if you can just put your shoulders back a little bit, go to the bottom of the scapula, and then go 2 intercostal spaces down. Put my thumbs there facing each other, and go ahead and take a breath in for me. Okay, notice that my thumbs do start to separate. His thoracic expansion is equal bilaterally, which is a normal finding. I'm also going to assess his antero-posterior diameter. You can just lift your arms for me. Okay, and so I'm just looking for a normal 1 to 2 ratio. Again, going down to that T10 mark. So it should be 1 to 2 ratio, which he is. An abnormal finding would be if it was a 1 to 1 ratio, which would be like a barrel chest. So I'm next going to assess for tactile firmness of the posterior cavities. I'm going to go on this side. And again, when I touch you with my hands, I just need you to say 99 each time, okay? Actually, you know what? First, I'm going to palpate and feel for any signs of crepitus or tenderness. And I have noted, looking at the skin, that it is evenly distributed in color, pink undertones appropriate to his ethnicity. I do not see any signs of lesions, no signs of ecchymosis or erythema. So as I palpate your back, just let me know if there's any tenderness. And I will also be assessing for signs of crepitus. Okay? Any tenderness?
No.
Okay, I also don't feel any signs of crepitus. Okay, now I'm going to move on to percussing. So again, when I touch parts of your back, just say 99 each time. There's going to be more fields to cover in the back than there were in the front, okay?
99, 99, 99, 99, 99, 99, 99.
Okay. He has good resonance. I did notice that the vibration starts to diminish, moving inferior from the neck, which is an expected finding. I'm also going to percuss the same areas to note his any areas of dullness. So can I have you sit up for me?
Yep.
Okay. So percuss. Okay. All the sounds were kind of a clear, hollow. Nothing was dull, which indicates there's no fluid or masses underneath the lungs. I'm also going to auscultate those same areas to listen for any adventitious sounds such as crackles, wheezing, or rhonchi. So each time you feel my stethoscope, if you could just take a deep breath for me, or just a normal breath. Again, we're beginning with the apices of the lungs. Moving down the back towards that T10 mark, bilaterally. Breathe for me. Just normal. Lift your arm a little bit. Another arm. Deep breath. Okay. I did not note any adventitious sounds such as cracking, wheezing, or rhonchi. One thing I want to do is flip back to the front for me. I did forget to assess the valves of the heart. If you can flip back to the front for me, please. The ape to man acronym. So we're going to be looking at the aortic, pulmonic, the Erb's point, tricuspid, and mitral valves. So just to identify where I'm going to locate these, here's a sternal notch. We're going to go on the right sternal border down to the second intercostal space. That's going to be our aortic valve. Going over to the left sternal border to the second intercostal space, that is the pulmonic valve. Going down to the third intercostal space, that's Erb's point. Going down to the fourth intercostal space is the fifth intercostal space, excuse me, that's the tricuspid. And then the fifth intercostal space midclavicular line is the mitral valve. So I'm going to assess the S1 and S2 sounds. We also call those the lub-dub sounds. Okay. So again, a sternal notch going down to the right sternal border into that second intercostal space. Okay. His heart sounds were regular. I didn't hear any extra sounds or murmurs. His in the aortic and pulmonic valves, the S2 sound is more prominent. In the tricuspid and mitral valve areas, the S1 sound is more prominent. And then I'm going to verbalize how I would assess for his PMI, where his apical pulse is, and PMI is the point of maximal impulse. And I would go down to the fifth intercostal space midclavicular line, have him lay on his left side while doing that to assess for that. But unless he's extremely thin or in some type of respiratory distress, that's not going to be something I would find at a normal examination. Okay, the last thing I'm going to do is take a look at your lower extremities. If you could lay on the couch for me, please, or the table.
You want me?
Yeah, you can put your feet down here. Just going to move this a little bit closer so we can see. Maybe take the book down a little bit. Okay, there we go. Just to make it a little more transparent of his legs. Okay. So I'm going to, first of all, do you have any weakness in your legs?
No.
Do you have any issues with range of motion?
No.
Any atrophying?
No.
Okay. So I'm just going to roll up your pants here just to see the skin color and the hair distribution. I see that his skin color is appropriate to his ethnicity. Hair distribution is even, matching the color of the hair on his head. I'm going to feel along bony prominences for any signs of edema, which I would grade if I found any. But I don't notice that he has any edema as I'm feeling his bony prominences. I don't see any signs of masses, lesions, erythema or ecchymosis or anything like that. I'm going to assess, go down to the feet, look at his cap refill. It is brisk. Cap refill returns in less than 3 seconds. I'm going to assess his dorsalis pedal pulse. They are equal bilaterally at a +2+. His anterior tibial pulse. Those are also equal bilaterally at a 2+. Going up to his popliteal pulse, these are more difficult to find. I'm going to just go from underneath the legs. They're just a little tougher to find here. Okay, so these are equal bilaterally, about a 1+. Can you lift your leg, each leg from me one at a time? Okay. Any weakness there? Okay, the other side. Okay, put it back down. Okay, can you pull your toes towards you? Okay, push towards me. Okay, the last thing I'm going to do is assess for, tell me what you feel, whether it's sharp or dull. Okay.
Sharp.
Okay.
Dull.
Okay.
Sharp. Dull.
Okay. So his senses and nerves down there, he can differentiate between sharp and dull. So that does conclude the exam for today. Do you have any questions for me?
No.
Okay, if you have any questions or concerns, feel free to use your call light. And I have his bed at the lowest position with 2 side rails up for safety. And his personal belongings are within reach. Thank you for your time today, Mr. Hughes.
Thank you.
I wish you a good recovery. And I will wash my hands and then close the door as I leave. Okay, so that is it.